When making a decision about surgery, I really like to think about it as an analysis of the potential benefit against the potential risk of the surgery. Let's talk a little bit about a way of thinking about risk and some of the things that I think can get in the way of our decision making with regards to the risks of surgery. There are certain risks that we more or less accept in life in our day-to-day living. For example, getting in our car and driving wherever we need to go. There's a risk in doing that, but we're used to it. We're not afraid of the risk. We probably don't even really think about it all that much when we get in the car to drive somewhere. Sometimes risk in medical decision making can be overstated, or the fear of a particular risk can outweigh its real value. A good example of this was in a very large women's health study done many years ago on the use of hormone replacement for women that were in their 60s and older. In this study, the risk of having cancer when on hormone replacement was higher than those who were not on hormone replacement. As a result of that increased risk, the rates of and usage of hormone replacement therapy dropped. And hormone replacement therapy really for a long time had a very bad connotation. When you really look at the numbers though, the risk of having cancer as a result of hormone replacement was probably on the order of 1 out of 1,000 patients that had the treatment, which is definitely a risk, but it's a 1 out of 1,000 risk. The risk of osteoporosis, on the other hand, as a result of not taking the hormone replacement therapy, may have been much higher. And we know, for example, that a hip fracture due to osteoporosis has a very high mortality rate. When we make medical decision making, we need to understand what the risks truly are and not what we perceive them to be. For example, when somebody comes in considering a lumbar fusion, some patients in their mind think, well, if I have a lumbar fusion, I'm going to have surgeries the rest of my life. It's the beginning of the end for me. Or I'm never going to be able to go back to the things I love. Or so-and-so had this particular complication and I'm afraid that's going to be me. And so the risk can start to cloud judgment. Whereas the real risk of having a lumbar fusion and needing another surgery in 10 years is probably 10 or 15%. So most patients don't, and some do. The risk of having some of the other complications is well known. And I think that as you consider surgical intervention, really understand the risk, not what you're afraid of so much and what the anxieties are, but what the real risks are. Have a conversation with your surgeon and other providers that have an understanding of these risks. And also converse with family members and other loved ones and friends so that you can gain an appreciation for what the risks truly are. And then take that information and also look at what the perceived benefit is. How severe is your problem? How much likely is it that you would improve with surgery? And as you start to explore the risks and benefits, then the surgical decision making can become more straightforward and the best decisions can be made.